what works and what doesn't.
I'm always a doctor, but this was one of the few times that I was a patient, and it can be scary.
The hottest trends in beauty and wellness.
Pull it up, keep it tight.
The prognosis is good. The Doctors, a prescription for a better you.
Yes, offering a prescription for a better you. Season 14 of The Doctors premieres Monday, and this morning we're talking with one of the hosts, Dr. Andrew Ordon. Good morning. Happy to see you.
Good morning. So good to see you. We go back.
Way back, that's right. Palm Springs. When I was working there on the morning show at CBS in Palm Springs, you have an office in Rancho Mirage. You used to come on a
morning
show.
Still practicing. I haven't quit my day job, but I'm loving my role as the host of The Doctors, along with some great co-hosts that we will have for you this season.
Well, congratulations, on season 14. Tell us about it. Tell us about what we can expect.
Well, we're never at a loss for medical topics that we need to share with America in general. So much happening. Obviously, COVID is the big issue. We're not through it yet. So many questions with COVID. Our kids are back in school. Flu season is coming. The vaccination for kids, the booster. I mean, this is just a few of the topics that we have to discuss, and we will.
Yeah, and you are also discussing other things. We just saw a video of people doing that crate challenge. Don't do it.
Bad idea. Do you see your kids building something crazy in the backyard? Like, go, time out, wait a second, because, I mean, the injuries that you can sustain with this challenge are pretty crazy. And, everybody they're a little stir crazy. They want to do crazy things that they can post on the internet to get some attention. Well, use the old noggin. Right. Don't be stupid. Don't put yourself in harm's way.
Dr. Ordon, you were talking about COVID, booster shots, flu shots. I mean, there's an important conversation happening right now. This morning, the FDA panel is meeting about the Pfizer COVID booster shot. You want to weigh in on that, and also the flu shot at the same time?
Sure. Well, as far as the booster shot, and I'm not surprised, just knowing what I know about immunology and vaccines in general, certain vaccines do need a booster dose. You remember your kid, you used to go to the pediatrician and you would get those boosters every few years. Well, we're finding that with COVID-19 that to have the best immunity possible, booster doses do help. So they're going to recommend it. They're just figuring out what the timeline is and who should get the booster first, et cetera. But I think it's a good idea. It will make a difference. We're seeing these breakthrough cases. Why is that? Well, I think the immune response does tail off a little bit. The booster dose, hopefully, it will boost it, and hopefully it'll make it last longer. But to your point, flu season, fall, it's flu and cold season, and it's troubling because when you combine that with COVID, it's going to be a little bit of a mess, because as we know, the symptoms of flu and the common cold are very similar to COVID. So people aren't going to be sure what they have. I think we're going to see a huge uptick in COVID testing. People are going to be worried. Just another reason, get that flu shot. I recommend that for everybody. You probably don't want to get it, exactly in close proximity to your COVID vaccine, but you definitely can get it. I would give it at least a few weeks, probably, in between the vaccines. Make sure you get it. And then during flu season, all the things we've been suggesting you should be doing during the pandemic are particularly important now. You may not want to hear it, but the fact of the matter is, wear the mask, wash your hands, protect yourself if you're sneezing. If you're sick, stay home. If you're around sick people, try to keep your distance, stay away, protect your kids, especially when in school. If in doubt, It's far better to keep them at home a day or two if there's a question than to spread it to the whole class. So lots of stuff we have to be vigilant about.
Right, lots to unpack, and you'll get to that. Quickly, we have about a minute less. Stress and sleep can have a big impact on our health and our appearance, and so many are struggling with both right now, especially with the pandemic. Any advice to help us? How can we?
I'm glad that you touched on that, and we have a whole new franchise that we're going to be running the whole season. The United States of Exhaustion is what we call it, and we are exhausted. It's been trying. It's been a stressful time for all of us with the pandemic at home, our kids, vaccinations, all of these things, working from home, issues with work. Hey, it's affecting our sleep. So we're going to be giving you tips. We have Dr. Bruce, who's our regular sleep expert. He has a regular franchise on the show. His segments are great. He's going to give you all sorts of tips on how to get your best night's sleep. He recently talked about the importance of adding vitamin D and manganese to your regimen. He says he swears by it, but he's all full of great tips from your mattresses and the do's and don'ts of what to do before you go to sleep. Really good stuff. We all need a good night's sleep.
Awesome. Well, looking forward to that advice. Again, congratulations on season 14, Dr. Ordon. You can watch The Doctors right here on the CW. Thanks so much for joining us. Great to see you again.
Thank you. Nice to see you. You have a great day.
You too.